Is there anything you can do to decrease the chance of tearing your ACL graft after having surgery for an ACL injury? I'm Dr. David, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. As I've talked about so many times, ACL injuries are so common, and the surgeries to treat them are really common too. In the US, over 100,000 ACL reconstructions are performed every single year. And the goal of that is to stabilize the knee so that people can play basketball or soccer or football or any kind of sport that involves cutting and changing direction or landing from a jump without their knee giving way. And it has good success rates at getting back to play. But it is possible to suffer a second injury. And so in today's Ask Dr. Geier video, I answer the question of how can you prevent that from happening again, and what should you look for to know if maybe you have suffered a second injury. Judy asks, "Great blog, thank you. I'm a 25-year-old female and had my ACL reconstruction about 2 months ago using the patellar bone tendon-bone graft. Physio and rehab have been going really well, and I started doing more heavy weight exercises. I'm constantly worried about my graft failing or stretching because it happened to a friend of mine. What are the signs and symptoms that I need to watch out for which could signal that I'm harming my ACL? Thanks a lot." Well, that's a terrific question, Judy, and I think it's absolutely one worth discussing. So let me address the first part, and then I'm going to show with my handy model here what to kind of look out for. The first part is that you want to minimize the chance of suffering a second injury. We do think that somewhere around 20% of people that have ACL reconstruction surgery will suffer a second injury, either tearing the graft, the reconstructed ligament in the surgical knee, or tearing the ACL in the opposite knee. So we do want to decrease that. And I think the best way to do that, better than a brace, better than avoiding activities, things like that, that's not good. We want people to be active, but you've got to get your leg, your knee, your whole lower body ready for that. So it's not just doing physical therapy to get your motion back and strength back per se. It's way more than that. It's getting your functional ability back and your sport-specific ability. So getting to where you can land on it equally side to side, and you can cut on it, and you can do everything you need to be able to do, and in that process you overcome your fear of re-injury. And that's why you might be in physical therapy for 9, 10, 12 months, which is tricky, at least here in the United States, because insurance a lot of times limits how much you can do it, but that alone is going to decrease your risk of re-injury. Now, as far as what to look for, it's the same type of thing as the primary injury. It's going to be something where your knee buckles or gives way. Basically, here's the knee, the femur, the tibia with the patella and the patella tendon in front, but you're looking for activities where that tibia rotates and shifts out of place. Now, it may not be as dramatic as the first injury where you have the big pop and it feels like something explodes in your knee. It may be a lot more subtle than that. But if you feel like your knee's giving out or buckling, it's worth talking to your orthopedic surgeon, having it evaluated, see what's going on. That's what I would look out for. But before you ever get to that point, get all your strength back, get all your functional ability back, your sport-specific ability back, and that'll at least decrease your risk of re-injury as low as you can. Have you suffered an ACL injury? And are you worried about a second injury? Or did you suffer a second injury? And what has been your experience with physical therapy? I'd love to hear your experience, and I know people watching this video all over the world would love to hear what you have to say as well. So below this video, tell us your experience. Type it up and let us hear what you have to say. I think it can help a lot of people going through the same thing. If you know somebody dealing with an ACL injury, trying to get through the physical therapy and the rehab to get back to sports, please share this video with that person so hopefully they might get a better understanding of what they're trying to accomplish, what they should try to accomplish to lower their risk of re-injury. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page on YouTube. It says subscribe. I record a couple of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. Again, please share this video if you know somebody going through ACL injury, ACL surgery, ACL rehab, so that hopefully it can help them. Thank you so much for watching, and I look forward to seeing you right here next time.